All right, well, I think we can just get started. It looks like Dia is just trying to connect to her audio. So good morning. We are here with Diane, Kurt, and Justin. We are going to do our retirement session this morning. My name is Jocelyn from the Greater Manchester Chamber, and I will be recording this session as well. So just in case if you can't stay on the whole time, this will also be on our YouTube channel and we'll send it out. We have Diane Danacourt from Trivantis, Kurt Zarnowski from Zarnowski Consulting, and Justin Hall from Rise Private Wealth Management.
Good morning, everybody. How you doing?
Hi.
Hey.
Perfect. So yeah, my name is Justin Hall. I work with Rise Private Wealth Management. I wanted to help host this event because when we help people towards retirement, some of the main concerns and questions they have are around Medicare planning and then also Social Security. Excited to have Kurt and Diane, and you know, Social Security and Medicare planning are just part of the overall picture of your retirement. So what we do at Rise Private Wealth Management is we just help folks figure out how all the pieces of those go together. So with Social Security in the picture and when you're going to take it and how you're going to take it, how do you recreate an income stream from the assets that you've saved over your lifetime? Maybe you have some pension questions. So we help folks look at the total picture, put it together, and then achieve a successful retirement. So if you have questions about that, I'll include my information in the chat box, and you can feel free to call or email me. We can have a complimentary consultation and just go over your situation and figure out what's right for you. So with that, I'll hand it over to Diane.
Okay, thanks, Justin. So I'm going to share my screen, and here we go. So this is what we're going to cover today. This Medicare is a, can everybody see it okay?
No.
Not yet.
Oh, okay.
I can't see it just yet. Let me go try now, Diane.
Okay. This was working 2 minutes ago, right?
I know.
What happened? Let's see. Oh no. All right. Maybe we'll do Kurt first.
Sure.
Okay, go
Let me
ahead.
try sharing my screen.
Okay.
There we go. Wonderful.
All right. So let me get rid of my picture. Hey, good morning, everyone. Welcome. Before we start, I want to say I hope everybody's safe and healthy and doing about as well as can be expected during these crazy times. Yeah, I'm Kurt Zarnowski. I'm currently the principal in Zarnowski Consulting. Those one or two not intimately familiar with us, proud to say we're an international consulting firm whose world headquarters are conveniently located here in the spare bedroom of my house in Norfolk, Massachusetts. But at Zarnowski Consulting, our tagline is we provide expert answers to your Social Security questions. And why can I say that? Well, simple, because I worked for the Social Security Administration for 34 years. And for the last 20 years of my career at Social Security, I was the communications director here in New England, which meant I spent my time, as our Canadian friends would say, oot and a boot, talking to people about the Social Security program. And in my retirement, excuse me, such as it is, I'm now actually in my 10th year of continuing to do that same type of work, largely because I enjoy the heck out of it, but also because I believe there's a real need for the information. Believe it or not, the Social Security program is now a little over 85 years old. And each and every month, Social Security pays about $88 billion in benefits to just over 64 million people. And on top of that, there's another 178 million folks who are out there working and paying into the program today. And what I've seen during my time with the agency, and now that I'm out on my own, is despite the age of the program, despite the size of the program, and despite the economic impact that Social Security has in this country today, unfortunately, the myths and misunderstandings that are out there about what it is, as well as what it isn't, are frankly staggering. Nobody knows nothing about the program. So I was excited to accept the Chamber's invitation to spend the next 7 or 8 hours with you, dispelling. All right. not going to spend that much time. Spend a little bit of time talking about some of the things I think it's important for you to know about what the program is, and equally importantly, understand what it isn't, dispel some of those myths and misunderstandings, set you down the road to the comfortable retirement we all hope to enjoy. Most important slide in the presentation is going to be this one. Oh, by the way, if you want a copy of the slides, I'll send a copy to Jocelyn, and she'll be free to email a copy of the PowerPoints to anyone who wants one. It's this one. Key message from me, you'll hear me repeat it. People need to understand that the Social Security program was created to provide simply a base or a foundation of income that people can count on being there for them in retirement. But it's a base of income protection that people must take steps to supplement, because it was never intended to be anyone's sole source of income in retirement. But unfortunately, these days, about 23% of retiree couple households, the Social Security money that comes in each month is virtually the only income those folks have. A terrible situation. So I'd avoid that happening to you. Simple, by planning for retirement, obviously, and to be commended, taking time out of a busy schedule, spending a little time this morning planning for this aspect of retirement. Now, for the longest time, the Social Security Administration tried to play a proactive role in helping you plan for your retirement, because back in the day, they used to mail you an annual Social Security statement, that paper document designed to show up in your mailbox about 3 months before your birthday on an annual basis, giving you important retirement planning information, benefit estimates at 3 different ages, 62, your full retirement age, or 70. We'll talk why those are important ages in a second. The other thing the statement did that was so important was it provided you a nice year-by-year breakout of what the Social Security Administration had recorded as your work and earnings under the program. We'll see in a little bit, what you eventually collect is directly related to what your work and earnings have been. So if a mistake had occurred in crediting you with some earnings, it was important to catch it and correct it, because if you didn't, have a direct impact on what you'd eventually collect. But you may have noticed, hey, I haven't gotten one of those every year lately. What's the deal? Well, Social Security has significantly altered its distribution plans for Social Security statements. And the big news is they no longer mail paper documents to anyone and everyone on an annual basis. Instead, what they've done first and foremost is put in place a system whereby if you go to www.socialsecurity.gov/myaccount, take about 10 or 15 minutes or so to set up an individual account for yourself. A byproduct of having that account in place is you'll be able to download through a secure website a Social Security statement for yourself whenever you need one or want one. And if you haven't set up that account for yourself, I'd encourage you to do so, because you're going to meet with somebody, do some retirement planning. Being able to download and bring to that session a current Social Security statement, going to make that a more worthwhile exercise. So take advantage of that socialsecurity.gov/myaccount, set up your individual account, be able to download a statement. By the way, Social Security has announced if you're 60 years of age or older and haven't set up an account, they are going to mail you a paper document, same old schedule, but that's it for mailings. Under the age of 60, the only way you get a statement is by setting up your account. But my view is, even if you're over the age of 60, I think it makes set up that account, because again, you're going to meet with somebody, do some retirement planning, like with Justin, then having a current statement is going to make that a more worthwhile exercise. So take advantage of the Social Security statement designed to help you recognize programs intended to provide that base, that foundation of income, but never intended to be your only source of income, and you need to find ways to supplement it if you're going to have that comfortable retirement. The sooner you start that process, the more likely you are to have that comfortable retirement. So let's talk about retirement benefits. And as I travel around the country and talk, wait a minute, who am I kidding? I'm not traveling around anywhere anymore. I'm locked here in splendid isolation at the world headquarters of Zarnowski Consulting. But when I used to travel around the country and talk to folks about retirement, the single most frequently asked question had to be, when should I take my money? So understand this, under the rules of the program, you've got a lot of choices and you've got a lot of options. And what I'm trying to do this morning is make sure that you fully understand what those choices and options are. In other words, I want to make sure you fully understand what you can do under the program. But ultimately deciding what you should do, that's entirely your choice, your decision. You're the ones who worked and paid into the program. I can't tell you what you should do. But my view is, unless and until you fully understand what you can do, you're in no position to decide what you should do. So let's make sure you understand those choices and options that are available to you. And the place to start is by making sure you know what Social Security calls your full retirement age. Now, when the program started back in 1935, Social Security full retirement age said as the month you turned age 65. It was age 65 for everyone without exception. And it continued that way till 1983 when Congress changed the law, increased full retirement age for anyone born 1938 or later. Currently, for a big chunk of the baby boomers, full retirement age is age 66, but important to note, it continues to increase, tops out right now under current law, that full retirement age, somebody born 1960 or later, is the month you turn age 67. Now understand this, collecting at your full retirement age month, that isn't your only choice, it isn't your only option. But make sure you know what your full retirement age month is, because you'll see as we go through the discussion this morning, a lot of features of the program do flow from at least having reached full retirement age. But in terms of collecting benefits, you have to start at your full retirement age month. That means one thing and one thing only. It means you'll collect 100% of the amount your work and earnings have entitled you to collect. And we'll talk in a second how that all gets calculated. But starting at full retirement age, you get 100% of your benefit. But among the many options you have are to start collecting prior to reaching your full retirement age, if that makes sense for you. And under the rules today, you can start to collect retirement benefits as early as the month you turn age 62. But here's the thing. Social Security, as the name implies, it's a social insurance program. And Congress has built certain social goals into it. And one is a hope that at the end of the day, based on average life expectancy, that people will end up with same amount of money on a lifetime basis, regardless of when you start to collect. And so you have to start collecting prior to reaching that full retirement age month. Well, then by starting sooner, in theory anyway, you'll be collecting for a longer period of time. You're going to find that your monthly payment amount gets reduced. How much of a reduction? Well, it's roughly 0.5% per month for each month prior to your full retirement age you opt to collect. 0.5% per month reduction, roughly a 6% per year reduction by starting early. But again, you don't have to start on your birthday. You don't have to start the first of the calendar year, but at whatever point you start, if it's prior to reaching your full retirement age, you'll find that your payment amount's been reduced by roughly 0.5% for each month that you plan to collect. And oh yeah, it's a permanent reduction. None of those myths that are out there, too many folks mistakenly believe, yeah, I'll start early, I'll get less, but as soon as I hit my full retirement age, my payment will bump back up. Permanent reduction. Again, the idea being starting sooner, in theory, you'll be collecting for a longer period of time based on average life expectancy, so you'll be given less on an individual monthly basis. Now, as I said, you start at full retirement age, you get 100% of your benefit, but among the options you have are to start collecting past your full retirement age, if that makes sense for you. And if you opt to defer, well, then by starting later, in theory, then you'll be collecting for a shorter period of time. So by all rights, your monthly benefit amount ought to be increased if you wait. And it is. These are referred to as delayed retirement credits. And for each month past your full retirement age, you opt to defer, you'll find your benefit now increased by 0.2% per month. Now, 0.2% per month, that translates into an 8% per year increase by waiting. But again, you don't have to not collect for a full year. For each month past full retirement age you defer, your benefit permanently increased by that 0.2%. But here's the key thing. Delayed retirement credits only accrue from your full retirement age month until the month you turn age 70. Full retirement age to age 70. Now understand this, under the rules of the program, you never have to take your Social Security benefit. Not like there's a required minimum distribution or anything like that. But if you opt to defer from your full retirement age up until age 70, you'll find your payment increase permanently by 0.2% for however many months have elapsed. You opt to defer past age 70, you can certainly do that, but you're not going to see any additional increase if you wait. So let me give you a couple of examples. Here we've got somebody born in 1960, so her full retirement age is the month she turns age 67. What are her options? So let's say at her full retirement age of 67, she'd get $1,000 a month. She wants to start collecting at age 62, the earliest point, she can do that. But think about it, with a full retirement age of 67, she starts at age 62, she's gonna be collecting for a full 5 years prior to full retirement age. So she's gonna see a 30% reduction in her full retirement age amount because she started early. meaning she starts at age 62, doesn't get $1,000 a month. No, she gets $700 per month and continuing. She waits all the way until age 70, to age 67. That's when she gets that $1,000 a month. But say she wants to wait all the way until age 70 before collecting. Well, now that's a 3-year period between her full retirement age of 67 and age 70, means she'll see her payment increase by 8% for each one of those 3 years she's waited, meaning she starts to collect at age 70. She won't get $1,000 a month. No, she'll get $1,240 per month and continuing. Let's say she wants to wait and start at age 72. Well, it's still going to be that same $1,240 because there are no additional increases by waiting past age 70. Bottom line in all of this, it's your choice, your decision. What are the things you ought to be thinking about? Well, you know them as well as I do. Your health, longevity. I always like to remind folks, do you come from a family of long livers? Or do you come from a family of short pancreases? Bum. Line out of the movie Goodbye Columbus. I can't take credit for it. Do you need the money? You're going to keep working? All those factors come into play, but the whole idea always used to be based on average life expectancy. It wasn't supposed to matter. At the end of the day, based on average life expectancy, you're supposed to end up with roughly the same amount of money, regardless of when you started to collect. But you know what? Life expectancy is increasing. Social Security numbers say 65-year-old man today, on average, going to live to age 84. 65-year-old woman, on average, age 86. But even more telling to me, Social Security numbers say of today's 65-year-olds, 1 in 3 expected to live to age 90, 1 in 7 to age 95. We baby boomers and people who come after us need to recognize, because life expectancy is increasing, retirement could be a period of 20, 25, or maybe even 30 years or more. And so my personal view tends to be, because most of us, as we head into retirement these days, if we have any type of pension at all, far more likely to be the defined contribution type, 401k, 403b, 457. We're walking out the door, not with a guaranteed stream of lifetime like you used to get with that defined benefit pension. No, we're walking out the door with a pile of money. So it seems likely to me that later in retirement, that pile of money will have diminished somewhat. Later in retirement, seems likely to be that healthcare costs will be higher. So you may have a greater need for a higher monthly income later in retirement than when you make that initial transition. And one way to help meet that need is by delaying the start of your Social Security benefits. But again, it's not for me to say, it's your choice, your decision. I just want to make sure you're making that informed decision. And in its simplest form, you start sooner, you get a lower amount for the rest of your life. You wait longer before you start, you get a higher payment amount for the rest of your life. But to me, the important point is when Congress set the reduction rate, increase rate so many years ago, based on average life expectancy at the time, it was all supposed to come out about even. But these days, because life expectancy is increasing, I tend to think that good things come to those who wait. But again, not for me to say, your choice, your decision. As long as you understand the fundamentals, then it's fine with me, whatever you decide to do. So second area I always get questions about is, well, how do they figure out how much I'm getting anyway? So as I mentioned before, there's a relationship between your work and your earnings and what you eventually collect. But we'll see in a second, it's not a perfect correlation. But in calculating your benefits, Social Security simply uses a formula that Congress has written right into the law. Formula has a number of different steps in it. First step is Social Security will go back and adjust all of your prior year earnings for inflation, bring them up to what they are in today's dollars. But then once they've done that, they calculate your benefit by plucking out and averaging your 35 highest years of work under the system. Another one of those myths and misunderstandings. I don't know how many folks I've talked to mistakenly think it's my high 3, right? Or my last 5. Social Security benefits based on an average of your highest 35 years of work, a lifetime of earnings. So what happens if you don't happen to have 35 years we've worked and paid into the program? You've taken time out of the workforce to raise kids, care for aging parents, or perhaps work for a while in a job where you weren't paying into Social Security. Unfortunately, no provision for that. It's still going to be an average of your 35 highest years. And so if you don't happen to have 35 years of something, zeros get added in for those additional years. It lowers your average monthly wage and lowers your monthly benefit. But here's takeaway for this morning. Another reminder about Social Security being that social insurance program. And when Congress put the formula in place, they recognized people in lower paying jobs, less likely to have a pension, less likely to be able to save for retirement during their working years. So the formula tries to help people in lower paying jobs by providing a monthly payment which is intended to replace a higher percentage of their pre-retirement income, somewhere in the neighborhood of 55% of what they're making. Now, for somebody who's a higher earner, by all means, he or she receives more in absolute terms each month than the low wage earner does. But if you look at what that payment represents, it's actually designed to replace a smaller percentage, around 34% of what somebody's making at retirement. And for the average worker these days, a Social Security benefit only intended to replace around 41% of what you're making at retirement. In no case, low earner, high earner, or average earner, is it intended to replace 100% of what you're making at retirement, which leads us right back to that first slide I showed you. You got to recognize Social Security is intended to provide you this base, this foundation of income, but it was never intended to be your only source of income in retirement, and you got to find ways to supplement it. Two numbers for you to think about this morning. In the year 2020, the average Social Security retirement benefit being paid is $1,503 per month. $1,503 per month, or around $18,000 per year. Nothing to sneeze at, good solid base. Then people often ask, well, is there a maximum payment? Well, in 2020, someone who is at his or her full retirement age this year of age 66, and who for each of the past 35 years has had earnings at or above whatever the Social Security taxable maximum has been for each of those years, because that's an important point. Each year there's a maximum level of earnings subject to Social Security tax. This year, for example, you could make $500,000, but you're only going to pay Social Security tax on the first $137,700 that you make. So when it comes time to average your earnings, Social Security doesn't average in the $500,000. No, they only average in the earnings that have been subject to Social Security tax. So 2020, somebody at full retirement age of 66 this year, who for each of the past 35 years has had earnings at or above whatever the taxable maximum has been, this year he or she receives $3,011 per month, or just over $36,000 per year. $18,000 average, $36,000 max at full retirement age. Good solid base, good solid foundation, but you got to find ways to supplement it because it was never intended to be your only source of income in retirement. So let's talk about working in retirement. A lot of interest here too. And this is another topic where it's vitally important to know what your Social Security full retirement age month is. Because under the rules of the program, if you're looking to collect benefits prior to reaching your full retirement age month, but intending to work at the same time, you need to understand that you're limited in how much you can earn before it begins to impact your ability to collect. In the year 2020, under full retirement age, you're allowed to make up to $18,240 without any loss of benefits whatsoever. $18,240 or less, you'll collect full payments each and every month of the year. Now, you make above that doesn't mean you can't necessarily collect, because Social Security is then required to start holding back $1 in benefit payments for each $2 that you're over the threshold. So depending on how much you're making, you may not be able to collect even if you want to. So what counts towards that $18,240? It's earned income only. Wages and or net income from self-employment. That whole wide world of unearned income you might be receiving, a VA benefit, a General Motors pension, 401k distributions, bank interest, dividends, rents, none of that counts towards that $18,240. Earned income only. But the great news is, from the month you reach your full retirement age on, there's no longer any earnings limitation imposed on you whatsoever. From the month you hit full retirement age on, you can work and earn as much as you'd like and collect Social Security benefits at the same time. Often get asked the question, hey, I'm retired, but I'm thinking about going back to work. I'm not going to have to pay Social Security tax on my earnings because I'm retired, am I? If you're in a job covered under the Social Security program, you will absolutely pay Social Security on those earnings as long as they're covered under the Social Security program, which is good news for the folks at Social Security because they can certainly use the money these days. But there's potentially good news for you. As I mentioned, your benefits calculated by averaging your 35 highest years of inflation-adjusted earnings. And it's your highest 35 regardless of when they occur. It isn't necessarily your first 35, isn't necessarily your last 35. It isn't even necessarily 35 consecutive years. So even if you're retired, you go back to work in a job covered under Social Security. At the end of the year, you file your tax return. Social Security is going to do a match, and they will automatically compare that new year of earnings with the lowest of the 35 years that they had been using to calculate your benefit. And if that new year is higher, they'll drop out the low year, plug in the new year, recompute your benefit, and you'll be due a benefit increase going forward. And this ability to increase your payment through additional work and earnings, it continues forever. Delayed retirement credits, yeah, they stop at age 70. No additional bump past age 70 if you opt not to collect. But no matter how old you are, if you're working, paying into the Social Security program, and your earnings are higher than the lowest of your 35 years, well, you're going to see your benefit increase no matter how old you are while working. And the other bit of good news, frankly, about work is it never really hurts. So you've been a high-priced executive, but in retirement, take part-time job at the Dairyfield Country Club, driving the beer cart around. Make a couple $1,000s. At the end of the year, well, that couple $1,000s proves to be lower than the lowest of the 35 years that Social Security had been using in calculating your benefit. So what happens to your payment amount going forward? Nothing. It's always based on your high 35 years of work. So I said a while ago, I think good things come to those who wait. I think good things can also come to those who work, because as long as you're working, paying into the system, there's always the possibility that those additional earnings will increase your monthly payment. It'll never reduce it. So understand the importance of work. So I want to spend a couple of minutes talking about spousal and survivor benefits under the Social Security program. Now, spousal and survivor benefits been around for 60, 70 years or so, put in place, frankly, by Congress to support the economic model of the American family in the 1950s and the 1960s. And for me, anyway, as a baby boomer, the family that personified the American household in the 1950s and the 1960s was the Cleaver family from the TV show Leave It to Beaver. Jocelyn, Leave It to Beaver. It's on Nick at Night or TV Land or something. But in the Cleaver household, you had Ward and June. Ward Cleaver, though, he was the breadwinner of the house. He came downstairs each morning. He was impeccably dressed. He left for work, briefcase in hand. Now, we have no idea what Ward Cleaver did or where he worked, but we know he worked. June Cleaver, on the other hand, prototypical American housewife of the 50s and 60s. Well, as you recall, she came downstairs each morning equally impeccably dressed. She had high heels and pearls on at 8 in the morning. But June Cleaver never worked a day outside the home in her life. Her job was to have brownies and milk available for Wally and the Beeve after a hard day of school. Well, Social Security's spousal program supports the Cleaver family model in the following way. Ward Cleaver, breadwinner. At his full retirement age, he'll get a payment equal to whatever that mysterious work has entitled him to collect. So let's say he's full retirement age of 66 this year, and let's say he gets $1,000 a month. June Cleaver, as his spouse, at her full retirement age, is going to be eligible to receive a monthly amount equal to 50% of Ward's full retirement age amount, or in our example, $500 a month, that will be paid to her in addition to the $1,000 paid to Ward, and will be paid to her even though she may not have worked a day outside the home in her life. Now, for June to collect a spousal benefit, though, a few conditions have to be met. First and foremost, Ward must be collecting his own retirement benefit. June can't receive a spousal payment unless until Ward is actually collecting. Second, for June to collect, she has to be at least age 62. Earliest age spousal benefits to be paid, no different than on the retirement program. Now, if June is at her full retirement age, that's when she gets the full 50%. But if she opts to start collecting prior to that point, her payment's reduced as well because she's taken it sooner. And the third condition, June's payment is based on 50% of Ward's full retirement age amount, not necessarily 50% of the amount he's actually collecting. For example, Ward, full retirement age amount, $1,000, but he's opted to wait until age 70 before collecting. So in our example, he's getting $1,320 per month. June's spousal payment still only going to be $500 a month, 50% of his full retirement age amount. Those 4 years worth of delayed retirement credits that he's accrued, that 8% per year increase, that 32% overall increase, he's seen in his own benefit because he's opted to defer, has no impact on her spousal benefits based on 50% of his full retirement age amount. So she In this example, she actually gets less than half. But by the same token, say Ward had started to collect at age 62. So he would have been receiving 75% of his full retirement age amount. Well, June, if she's at full retirement age, still will get $500 a month, 50% of the full retirement age amount. Hey, but that's the 50s and 60s, right? Let's flash forward the 70s, 80s, and beyond, because now in all likelihood, June Cleaver will have worked outside the home, will have paid into the Social Security program, and will have earned a benefit on her own. So let's say June's earned a benefit on her own, full retirement age of $800. Ward's got his $1,000. They head to Social Security together. Each one receives. Social Security is about to say goodbye and good luck, and June goes, hey, where's that $500 spousal payment I've heard so much about? Well, at that point, the folks at Social Security go, sorry, June. As Ward's spouse, you can get that 50% of his full retirement age amount or your own, whichever amount is higher, one or the other, but you don't get both at once. Because in this example, her own $800 full retirement age amount exceeds 50% of Ward's full retirement age amount. That's what she collects. But say she hadn't worked that much, though, so her own benefit was only, $250. Well, she'd get her own benefit first, and then Social Security would give her an additional $250 on top of her own benefit to move her total amount up to that 50% of Ward's full retirement age amount. Spousal benefits. By the way, the program's totally gender neutral. What do I mean by that? Well, simple. Say back in the day, the Cleavers been ahead of their time, and Ward was the stay-at-home dad, and June was the primary breadwinner. Then everything I talked about would be equally true, that he could get 50% of her full retirement age amount or his own benefit. One or the other, whichever one is higher, but you don't get both at once. But what happens if Ward dies? Well, here the news for June is actually better, because as a widow, her payment's not going to be based on 50% of his full retirement age amount. No, it's going to be based on 100% of the amount Ward was collecting at the time he passed away, or would have been collecting had he started drawing benefits. Oh yes, still, or her own, one or the other. You don't get both at once. So for example, June's getting $800 a month, Ward's getting $1,000 a month. Ward passes away. Assuming June's over her full retirement age, she'll immediately receive an additional $200 a month, moving her from her own $800 up to that $1,000 he had been collecting. Now that's the good news. Her own benefit increases a little bit, but if you think about it, while he was alive, they were getting $1,800 a month in Social Security benefits. Her $800, his $1,000. He passes away. Sure, her individual payment goes up, but it's as if her old benefit goes away. Just something you need to plan for, because it's collecting one amount or the other, whichever one is higher. But here's the other point I want to make. So Ward, full retirement age amount $1,000, but he opts to wait until age 70 to collect. So at the time he passes away, he's getting $1,320 per month because he's accrued 4 years worth of delayed retirement credits. Well, the better news for June now is her benefit increases from her $800 past the $1,000 all the way up to that $1,320 per month, the amount Ward was collecting at the time he passed away. So just keep this in mind in deciding when to start to draw your own retirement benefits. Remember that by starting sooner, not only is your own payment lower than it would be if you waited, but it also means that any survivor benefit that could be made upon your passing is going to be lower as well. And by waiting, your own payment's going to be higher, as is any survivor benefit that could be made upon your passing going to be higher as well. So another reason why I tend to think good things come to those who wait. By the way, as I mentioned, the survivor benefit's based on 100% of what Ward was collecting or would have been collecting had he started drawing benefits. So Ward, full retirement age amount $1,000 at age 66, plans to wait until age 70 before collecting, but he passes away at age 68, never having drawn a penny. The good news for June is her benefit's based on that age 68 amount, so that 2 years worth of delayed retirement credits, that 8% increase for those 2 years he hasn't collected, does result in a higher survivor benefit for her. So again, good things come to those who wait. A couple other points about survivor benefits. Widows and widowers can collect as early as age 60, a little bit sooner than on the retirement and spousal program. But same concept holds, you start to collect prior to hitting full retirement age, you get a lower amount, you start right at age 60, you get 71.5% of the amount you'd receive if you waited all the way until full retirement age. But the third bullet is a key one, just a reminder. Yeah, I've emphasized you collect on one account or the other at a time. You don't get both full benefits at once, but it is possible under the Survivor program to claim a reduced benefit on one account and then switch to a higher benefit at a later date. So for example, June Cleaver, widow at age 60, could opt to collect a reduced widow's benefit, collect, and then at her own full retirement age, for example, switch over and begin to collect a full unreduced retirement benefit. The fact she'd been receiving reduced survivor benefits doesn't prevent her from collecting a full benefit amount on her own, and the reverse could be true too. At age 62, she could collect a reduced retirement benefit and then opt to switch to a full unreduced survivor benefit at her full retirement age. Again, you collect on one amount or the other at a time, but you can sequence the collection, but you never collect both full amounts at once. But keep this in mind. If you're under your full retirement age, whether we're talking about retirement benefits, spousal benefits, or survivor benefits, and you're working, you're going to be subject to that earnings limitation we had talked about a few slides ago. So June Cleaver, widow at age 60, working, making $500,000 a year. Well, she's old enough to collect a widow's benefit, but she's not going to be able to do so because of her work and earnings. But a strategy to think about is, and because she's happy to work and enjoys it, at her full retirement age, let's say at 66, she could claim a survivor benefit then, even though she's working, because at full retirement age, work and earnings no longer prevents you from collecting, and then defer collecting her own at age 70, swoop in, switch over from her survivor benefit to her own retirement benefit, then she'll get a payment that will be higher because of those delayed retirement credits that she's been accruing. Again, you collect on one account or the other at a time. You don't get both full at once, but it is possible to sequence, the collection and maximize your payments. Quick reminder about taxation of benefits. Prior to 1983, Social Security benefits were completely federal tax-free. But that year, Congress changed the IRS code, said if you were a higher income Social Security beneficiary, then you'd be required to pay federal income tax on a portion of the payments that you received. How do they define higher income? Well, if you're a single tax filer, if you have modified adjusted gross income in excess of $25,000, or if you're a couple filing jointly, you with that modified adjusted gross income in excess of $32,000, well, you're going to find yourself having to pay federal income tax on up to 85% of the payments that you had received in the prior year, treated as ordinary income, taxed at whatever marginal tax rate you happen to fall under. 85% of your benefits, maximum. 15% always tax-free. So what constitutes this modified adjusted gross income? Well, it consists of three things. It's your adjusted gross income plus any tax-free interest you may have received, plus 50% of your Social Security benefit payments. Add those three things up. If it's above those thresholds, you're going to find yourself paying federal income tax on a portion of your benefits. And the higher your income, the greater the number or the greater percentage that are subject to federal income tax. At the end of the year, Social Security sends you a 1099 form. Use that in filing your tax return. These days, about half the folks who get Social Security benefits do find themselves paying federal income tax on a portion of their benefits. The question often comes up, well, does Social Security automatically withhold a portion of my payments each month and send it to the IRS in advance? The answer is no, they don't do it automatically. But if you'd like to have a portion withheld, you can request that they do so. You fill out a form W4V as in Victor, and at your request, Social Security will withhold a portion of your payments, send it on in advance, may void the need of filing quarterly tax estimates. By the way, this is federal taxation only. State taxation rules vary from state to state. The vast majority of states, 37 out of 50, do not tax Social Security benefits. Obviously, New Hampshire with no state income tax is one of those. But there are 13 states here in New England, Connecticut, Rhode Island, and Vermont are 3 states that do tax Social Security benefits in some portion. So if you're going to leave and retire somewhere other than New Hampshire, just double check on the taxing rules in the state where you reside, because you may find a portion of your Social Security payments subject to state income tax as well. All right, so you've absorbed all of this information. You decided you're going to retire December 31st, and you want to start collecting Social Security benefits effective January 2021. What do you do next? Well, Social Security can accept an application for benefits a maximum of 3 months in advance of the month you want to start to collect. So you want to start to collect effective with the month of January 2021. That means you can apply for benefits as soon as October 1st of 2020 or any point after that. Now, how do you go about applying? Well, Social Security gives you options. You can apply online at www.socialsecurity.gov. And in my estimation, this is the way to go. They've done a lot of work to enhance the online retirement application. It's simple, convenient, easy. You can stop and start from the comfort and convenience of your own home wearing your pink footy pajamas for all anybody knows. Now, the thing is, to use the online retirement application, though, you do need to have established a Social Security account for yourself. So another reason why I think it's a good idea to have set up that Social Security account. But the online application probably take you about 20 or 25 minutes to complete. You're uncomfortable dealing online, dealing with the internet? Well, you can call Social Security, schedule an appointment, call 1-800-772-1213, set up an appointment. Now, prior to COVID, you could make an appointment to visit a local Social Security office. New Hampshire, Manchester, Nashua, Keene, Concord, and Littleton, I believe. But currently, offices are closed to the public, but you can still call and make an appointment for what is called a teleclaim. And Social Security will call you at the appointed hour, complete the application over the phone with you. At some point, offices will reopen to the public, but for the time being, closed to the public. And if you do want to deal with a Social Security representative, it will be over the telephone. But here's the important point I'd like to remind folks. So you've decided to collect effective the month of January. Social Security benefits are paid 1 month in arrears. So you decide to collect effective with the month of January. You're going to see your first payment in the month of February. Your January payment will be sent to you via direct deposit, no checks these days, will be sent to you in the month of February. The other point, though, is in the old days, Social Security used to pay everybody on the 3rd day of the month. But since 1997, benefit payments have been staggered through the course of the month based on somebody's date of birth. So if your date of birth happens to be between the 1st and the 10th of the month in which you were born, you will always be paid on the 2nd Wednesday of the month, regardless of the date. Your date of birth falls between the 11th and the 20th. You'll always be paid on the 3rd Wednesday of the month. And if your date of birth falls between the 21st and the end of the month in which you were born, you will always see your payment direct deposited in your bank account on the 4th Wednesday of the month, regardless of the date. So your date of birth is the 28th of the month. You intend to retire December 31st, begin collecting effective the month of January. Just be aware, you're not going to see your first Social Security payment until the 4th Wednesday of February. Just something you need to plan for, anticipate. The payments do go out 1 month in arrears, payment date staggered through the course of the month based on somebody's date of birth. All right, like Lady Godiva, I must come to my close. Oh, come on, that's funny. I always like to end my part of the presentation where I started with that reminder. Social Security, a hugely important program, but you got to recognize intended to provide you simply a base or a foundation of income that you can count on being there. But it's a base of income you must take steps to supplement because it was never intended to be your only source of income in retirement. And the sooner you recognize that, take those steps, the more likely you are to have that comfortable retirement we all hope to enjoy. So I hope the information's been helpful. Again, a reminder, have Jocelyn send you a copy of the PowerPoints. And if you do have questions, take them at the end. If you have questions that occur to you afterwards, get them into Jocelyn. She can forward them to me and I'll be happy to get you a response. So thanks for your time. I'll turn it back over. Maybe Diane, if you get your slides. So they work?
Awesome. Thanks so much, Kurt.
My pleasure.
And if anybody has any questions, you can put them in the chat box. And again, we can take them at the end. But if you tend to forget your questions like myself, sometimes I have to write them down. So feel free to do that in the chat box too.
Are you able to see my slides?
Not yet.
Okay. All right, how about now? Okay. All right, great. So that was very interesting. I think I learned a lot. All I know, one of the big things is I'm not getting my check until the end of the month. So I'm kind of bummed about that. My birthday falls at the end of the month. So anyway, so it's a good segue to what I do, because basically when you start talking about Social Security, you're going to start talking about Medicare, and it's very, very important timing, because you want to really, really take a really good look at it, because 65 is that turning point for looking into the health insurance options. And just like Medicare, it's extremely important. So today what we're going to talk about is the enrollment periods, time to decide which coverage is best for me, and if you want to know more information. So I'm just going to start with what Medicare is. It's a federal insurance program administered by the Centers for Medicare and Medicaid Services. What CMS is an agency within the Department of Health and Human Services. And then what Social Security Office is just what we're talking about, and that processes applications for Medicare and talking about the Social Security that Kurt was just talking about. Who is eligible for Medicare? Folks that are over age 65 or older, or under 65 with permanent disabilities. If you're age 65 or older, you're eligible if you or your spouse worked and paid Social Security taxes for at least 40 quarters, that's 10 years, or you're a permanent resident of the United States or a legal citizen who has lived in the US for 5 years in a row. So that's just about eligibility. So the big thing when you start talking about Medicare, there's different parts to it, and this is where I think everybody gets confused. So Part A, what Part A is about hospitalizations. So that's something that you're entitled to if you've earned that Social Security, you're entitled to the Part A. And then Part B is for doctor's office visits, x-rays, that type of thing. And then that's where you're going to have to pay a premium to have a part of the Part B. And then Part C is either Medicare Advantage plan, or that's where you would have a Med Supplement plan. And we will talk about that a little bit more, because I think that's the biggest part of this and the big decision that you have to make. And then there's Part D, which is the prescription drug coverage, or also it's abbreviated as RX. So this is a breakdown of what Part A is. It's hospital insurance. It includes hospital stays, skilled nursing facility care, hospice care, and some health care. So that's what the Part A is. Part B, medical coverage, is for doctor services, outpatient medical and surgical services, clinical lab tests, durable medical equipment, and preventative services. So what happens is once you have Part A and Part B, these claims, if you go in for any hospitalization or treatment, the claims go to Part A and Part B, and they process first. And then what happens is they both have charges that aren't, because Part A and Part B does not cover everything 100%. So there is going to be a leftover deductible as well as co-insurances under the Part B. And so that's where the Part C comes into play. So I'm just going to back up a little bit on the Part B. You must have Part B. So A, you're going to have automatically once you go to the Social Security office. But in order to go on to either a Med Advantage or Med Supplement, you need to have Part B if you want to join those, or if you're eligible for TRICARE or your employer coverage requires it. So this is when I was saying that you are going to pay some costs for Part B. This is a chart. This is for 2020. So if you've made $87,000 or less in 2018, your premium cost for Part B is $144.60. So if you've made more than that, or if you've filing jointly, this is what cost is going to be for 2020. That number will change in 2021. It will go up a little bit. So you want to take a look at those costs if you're considering this, so you can incorporate this with your total cost. So what Medicare Advantage is that private insurance companies pay. So when I was talking about that there are charges that the Part A and Part B do not cover, there is going to be a deductible that is left over, and there's also going to be those co-pays that Part B does not cover. So what happens is either Med Advantage or Med Supplement is going to cover those costs. With Med Advantage is one of the options. So there's two very distinct paths you can take. You have the A and B, and then you can go the Med Advantage route, or you can go the Med Supplement route. So Med Advantage is going to cover the things that, they're both going to cover the portions that Med A and B do not pay, but with Med Advantage, they have additional benefits that they might cover, whether it's dental care, eye care, foot care, chiropractic services. They might cover meal delivery and transportation. So there's other benefits above and beyond what Medicare covers that you can take advantage of with Med Advantage. And then with Med Supplement, well, we can go into that in a little bit later, but so there's two very distinct paths, and Med Supplement does not cover those items, but what they do is they do cover everything in full, so you don't have any additional charges. With Med Advantage, you will have extra, you may have additional co-pays, so, but we will talk about that. The enrollment periods is really important as to when you're going to decide to go on to Medicare. So what happens is what most people are that are turning 65, what they're experiencing is the initial enrollment period, and that lasts 7 months around the time of your 65th birthday. So it begins 3 months before the 65th birthday, the month of your birthday, and 3 months after. So they're giving you all that time that you can enroll, and then the month of your birthday, you can enroll the first of that month. So you really want to start thinking about it when Kurt was talking about going into Social Security. You can start doing that 3 months before, even if it's just exploring what your options are and knowing, because you want to really take a good look, especially if you're still working with an employer group. You really want to take a good hard look at what your options are before you go off onto Medicare, because a group plan may have better options. And what happens is if a group has better options, you might want to hold off getting onto a Medicare plan, but you really want to take a good look at it. And that just brings me to one of the most important points is before you make any decision on any of this, you know, I'm giving you a really, really high level. There's so many layers to everything that I've been talking about. So it's important to really talk to somebody that can really sit down and explain it to you. If you try to just go online, what happens is everybody that I've talked to that's gone online, they start Googling things and they start getting 1,000 phone calls and everyone's sending them every which way. You really want to just sit down with somebody and really have them explain everything and all your options and understanding, you know, going over what Part A is, what Part B is, and then this fork in the road, do you go with Med Supplement and Med Advantage? And one of the things that I've learned is that, you know, I've been in a room with, 20 people, and everybody in that room has a different scenario of what's important to them, whether they're still working, not working, disability, spousal coverage, employer coverage. There's so many different things. So it's important to take every factor into consideration when you're making that decision. So when it's coming up to your 61st birthday, don't wait until like the month before. You really want to start looking and sit down with somebody that can talk to you and really explain what your options are. But this is one of the enrollment periods is when you're 65. And so you can, if you're still working, you're not going to be penalized if you wait until, say you don't want to retire, you want to do what Kurt's saying, say you want to work till 70 years old. You're not forced to go on to a Medicare plan. You can wait till that point to pick a plan, but you want to really make sure you compare the two and what your total costs are, because group plans can be very expensive. So looking at these Medicare plans, they have some really good benefit options. So you just have to see what's right for you. So one of the things, this is another general enrollment period, and this is for those who do not sign up for Part B during the initial enrollment period. So this is another option for those folks that did not sign up for Part B during their initial enrollment period. And then, of course, this is what when you're watching TV and we're seeing 1,000 commercials right now and hearing them on the radio, this is the annual election period from October 15th to December 7th each year. And this is an opportunity for those folks that may have selected a plan last year and for whatever reason they want to look into something else. You can switch to original Medicare, and whatever that you pick, this is a good opportunity for them to make any changes. That coverage would be into effect for January 1st. So what coverage is best for me? This is what I'm really want to, really point out, that this is the most important part, is understanding what your options are. So Medicare Supplement Plan is a comprehensive coverage. It is a cookie cutter plan. So there's, I think there's 26 carriers in the state right now that offer Medicare Supplement Plan, and they're all the same. They all have plans that range A, B, C, D, E, F. They're all the exact same plan. Some of them might offer like silver sneakers, some gym membership, but the plan itself and what they cover is all the same on each of the Medicare supplement plans. And these tend to be a little bit, there is more of a cost associated with it. So this is one option. And just to say, if you're eligible, you have to be enrolled in Medicare Parts A and B and a resident in the state you want coverage in, and of course 65 or qualify for disabilities to have this Medicare supplement plan. So I'm showing you Anthem slides. I work with a lot of different carriers, but I like the Anthem slide, so that's why I'm using that. But that's what Medicare Supplement is about. And then Medicare Advantage, that also combines Part A and B, and it also includes Part D prescription drug coverage. So it incorporates it all into, so you almost have one card. And then this is where you can also have additional benefits added into this one: routine dental, vision, and hearing. And it includes wellness services, including gym membership. So same deal, that you have to be enrolled in Medicare Parts A and B and live in the service area in order to have the Med Advantage plan. So, but the difference with the Med Advantage is there's so many different carriers, but all the plans are very, very different. So here's a chart with saying what the differences are between the two. So the Medicare Advantage can have a really low monthly premium, some as low as $0. You still need to pay your Part B premium. But they have a certain network of doctors or hospitals. So it's important when you're meeting with that person to talk about Medicare, that you're going to have a list of your doctors and prescriptions, and you're going to go through and make sure that that plan is the right one for you. So I've even had a couple, and the husband and the wife have two very different needs. So one goes on one plan and may want to go on the other. So it doesn't, you can have those choices. One can pick one carrier and one can pick a completely different carrier. So some of these plans, though, you have to make sure you also see these, that they have out-of-pocket deductibles and co-insurance and payments. So even though the premium's lower, there may be some out-of-pocket expenses here that you need to be aware of and take into consideration, like how many times you're seeing a doctor, or how many times you may go to the hospital a year. So you really need to know and take a really solid look before you pick either one of these. So emergency coverage while you travel. Most of these Medicare Advantage plans do include Part D. One of the big advantages that Medicare Advantage has, there's one card to carry. You don't have to have multiple cards with the Medicare Advantage. And this is the one I've mentioned, has a lot of extra benefits. The Medicare Supplement Plan has higher monthly premiums, and it's a lower out-of-pocket expense, though. So you're not going to be getting those additional co-pays and that type of thing out of pocket. So you can use any doctor. So there's a little bit more of a network range for you. You can use any doctor or hospital that accepts Medicare patients. It's very important that they accept Medicare. But if you do that, it should be covering most of your deductibles, co-insurance for medically necessary care. Now, these plans, a Medicare Supplement Plan, do not include Part D. So you could have one carrier for your Medicare Supplement, and your Part D is purchased separately. And again, there's so many different carriers out there. So if you decide to go this way, you want to make sure that you have your list of prescriptions. So the person who's helping you can go out and make sure that you're picking the right carrier. So you must have all your cards with you when you're going in for services to make sure you get coverage for everything. Very important. And this is the Medicare Supplement Plan comparison. And this is what I was saying, that so every carrier that offers Medicare Supplement plans, this is what they cover. So if you look at the Medicare Supplement plans, what you need to decide is looking at these different plans and say, well, which plan do I want? But you can, they're offered through, every carrier has the same one. So what would happen is when you're sitting down with the person that you're talking to, they're going to explain what the differences is, and you can see the check marks of what covers and what they don't to make sure that you have picked the right plan with the right carrier. So Part D, we talked about that a little bit. Part D is all about prescriptions, and it's and there, like I said, there's numerous prescription companies out there. And so if you go with a Med Advantage, it's included. Most of them are included together. And if you get a supplement, it would be what they call a standalone prescription drug plan, also known PDP. When you see that term, that's what that means, is that it's a prescription company. So going kind of reviewing a little bit, you've got A is hospitals, B is doctor's visits, C is the Med Advantage or going with a Med Supplement plan, and then Part D if you need it, if you don't pick a Med Advantage plan. So, so when we were talking about this, there are extra savings and extra help out there for folks. So if anybody needs help, you need to go on to sue the state. And what they do is they take your income information, and sometimes they can pay, depending on what your income level is, that they can pay for Medicare premiums, or sometimes even they can maybe cover Medicare deductibles and co-insurance. So again, this is something you really want to talk to somebody to make sure that you understand, because you may be able to get additional benefits. So it's a very important, there's definitely extra help out there. We just got to know where to go and get that help. So time to decide, like I said, this is another chart, is it helps you kind of decipher, well, which way is the right way for me? It's one of the biggest decisions you're gonna have to make, because down the road, if you do select like a Medicare Advantage plan, one of the things you need to know is that if you're going to go to a Medicare supplement plans, they may be underwritten in order to go onto that plan. So what that means when they talk about Medicare underwriting is that they're going to ask you questions, and they are subject to denial. So you want to make sure you understand those options. Medicare Advantage, you need to know if you're trying to keep your costs as low as possible, Medicare Advantage is the way to go. If you're going to move, you need to make sure that you move into another plan service area, because if you go out of area, you want to make sure that you remain in that area. And so you're always getting the best coverage. And then you want to know what extra benefits are important to you, because that's one of the big things with Medicare Advantage companies, is they all have different extra benefits. So you want to know what's important to you. Some people want to have an extra dental benefit or hearing benefit, or meal plans where they deliver meals to you, or actually give you rides to the hospital or doctor's office. So every single plan has different benefits, and they're all good, but you want to still pick the one that's right for you, and prescriptions as well. Which cards to carry. This is the Medicare Supplement. So that Medicare card, that's what you're going to be getting, what Kurt was talking about. That's what it's going to look like when you get that from, that's your Medicare card for Part A and B. And then this is a picture of an Anthem card, and then the prescription card. Or get a lot of clicks here. Or if you go with a Med Advantage card, they're going to have one card for that. So the most important things I want you to have as a takeaway is that Medicare is a health insurance program. It doesn't cover all your costs. So that's where you have to really look either at the Advantage or the supplement card. You have choices in how to get coverage. And decisions are very time sensitive. So you always want to make sure that you get, give yourself plenty of time to really look into options. So if you want to know more information, this is some really key websites for Medicare. This handbook is very, very valuable. I have some that I keep that I'm happy to share. You can go to the Medicare.gov website, the socialsecurity.gov is on here. The Medicare find a plan questions option. Email is on here. And the Centers for Medicare and Medicaid. And certainly my information is on here as well. So you can reach out to either one of those emails or give me a call, and I'm happy to answer any questions for anybody. So thank you. And again, the biggest thing is just talking to somebody about this and just knowing the differences between the options. So Jocelyn, if anybody has any questions or.
Yeah, thank you so much, Diane. That was super helpful. It looks like Joanne Duffy has a question. She says, can you collect Social Security at age 65 at a reduced rate and continue to work, or do you need to be at full age?
Yeah, so good question. So again, you got to understand what your full retirement age month is. And if you're looking to collect benefits prior to reaching your full retirement age month and intending to work at the same time, you can do that, but you're limited in how much you can earn before it begins to impact your ability to collect. And this year, if you're under your full retirement age, you can make up to $18,240 without any loss of benefits, but you make above that, Social Security then starts to hold back $1 in benefits for each $2 that you're over the threshold. So you can work, but making more than that annual threshold amount, and it's going to go up year over year, it starts to impact whether you can collect or not. But from the month you reach your full retirement age on, no longer any earnings limitation whatsoever. And from that full retirement age month on, you can work and earn as much as you want and collect Social Security at the same time. Good question, Joanne.
And she also has one more two-part question. Can you talk about Social Security benefits if you are divorced? If you are employed full-time and receiving excellent benefits, should you file for Part A when you turn age 65?
So I'll deal with the divorce question, then turn it over to Diane for the second part. So with Social Security divorce spousal benefits, it's very similar to spousal benefits. So Ward and June, they get divorced. Can June collect based on Ward's work record? Well, the answer depends. Marriage needs to have lasted at least 10 years prior to the divorce. June cannot be married. Ward can have remarried without impacting her ability to collect on him, but for her to collect as a divorced spouse, she cannot be married. Thirdly, she has to be at least age 62, earliest age, no different than regular spousal benefits. But here's the key difference. I mentioned if the marriage were intact, June couldn't collect on Ward's work record unless he was actually collecting. But what the law says in case of divorce, as long as both of them are over the age of 62 and the divorce has been finalized for at least 2 years, she can collect as a divorced spouse based on his work record, even if he has not yet started to collect. So with all those conditions being met, what's she entitled to receive? Well, simple. It's as if the marriage were intact in essence. She can receive 50% of his full retirement age amount or her own, one or the other, whichever one is higher, not both at once. And he passes away, she's eligible to collect 100%, just like a regular widow's payment. Now, the other thing the law says in case of divorce, each ex-spouse treated absolutely, totally, completely independently from one another. So Ward can have a whole series of marriages. Each one of those exes, if they meet the requirements, can collect without adversely impacting anyone else. So basically 10-year duration of marriage requirement, can't be married. Then you're basically treated as if the marriage were intact, with the exception that you can potentially collect even though the ex hasn't started to collect if you're both over the age of 62 and the divorce was finalized at least 2 years ago. But as far as claiming Part A when still working, Diane, you're muted.
Oh, okay. Sorry. Yep. Sorry about that. So yes, so the answer to your question for filing for Part A, that I would go file for Part A when you turn 65. I definitely would do that. I mean, you have nothing to lose. It doesn't cost anything. And it just, if you're on a group, it depends on what size group you are, whether like who's going to be primary or not, as far as, so it does help, but you have nothing to lose. And I would recommend them doing that.
I agree with that 100%. No harm, no foul, doesn't cost you anything. No reason not to sign up for Part A at age 65.
Thank you.
Yeah, and if anyone has any more questions, feel free to unmute yourself and turn your video on if you'd like to ask the question, or put it in the chat box. I'm happy to read out loud the questions like I did for Joanne.
Okay, somebody handed me a question, so I'm going to, for Kurt, it says to ask you if they're eligible to get $1,840 a month next March 2021. If they don't take it then and they wait 12 months, will it be prorated per month? If they're 62, when they're saying they're making $1,840 a month in March.
18,240 during the course of the year. So here's the thing. Keep in mind, you opt to collect your benefits prior to reaching your full retirement age month. Your full retirement age amount is reduced by roughly 6% for each year that you opt to collect. So working backwards, for each year then prior to full retirement age, you defer, you're going to get, by waiting 12 months, 6% more if you collect another year down the road. But once you reach full retirement age, the increase by waiting is actually 8% per year. So you start to collect, say your full retirement age is 66, you opt to collect at 62. Well, if you wait till 63, you'll get 6% more. 64, another 6%, 65, whatever. But then if you defer from full retirement age of 66 on, with each year you defer, it's 8% per year, but it really is passed out or accrued on a monthly basis. So it's 0.5% per month reduction prior to full retirement age, 0.2% per month increase if you're collecting past full retirement age. I'm not sure that answers the question, but
I'm not sure. Yeah, I think it does. Yeah, and then they have more questions. I'll reach out to you.
not a problem.
All right.
Awesome.
Anybody? Bueller? Anyone?
I'm not sure if anybody has any more questions, but if they do, I can always share my contact information and send that over to you, Kurt, or Diane, if that works. Yeah, I'm not seeing any other questions, but
All
that's
right,
okay.
and again, I will email a PowerPoint to you, Jocelyn, and feel free to send it along to anybody. I'll get that to you later this afternoon.
Wonderful. Yeah, that sounds fantastic. I will be sure to send that out to everybody.
Good.
Well, great. All right.
All right, everybody, thank you very much.
All right. Thank you, Kurt.
Thank you.
Stay safe, stay healthy, wear a mask.
Yes, of course.
I will.
All right. You too.
Take care.
All righty. Bye-bye.